I'm Andy. Welcome to this week's Teen Kentucky Update. It is June 15th, which means it is Will Beshear's birthday. My son is 14 today. Kentucky's economy continues to grow. And this week I have a great project to highlight. Since the beginning of my administration, we've now announced more than 860 new location and expansion projects for over $26.6 billion in new investments. As we sit here today, we have a record number of jobs filled in the Commonwealth, over 2 million. That is more jobs filled than at any other time in our history. Right now, more than 57,000 more jobs filled today than before the pandemic. So we are not just bouncing back. We are breaking records with a red-hot economy, and it's helping more Kentuckians than ever. On Monday, we announced that Wheeler USA is locating a manufacturing operation in Louisville. This project includes $11.5 million in investments that is creating 24 high-wage jobs for our residents for an average incentivized hourly wage, get this, of $42.77, including benefits. Better yet, this location is going to be the North American headquarters of this company. So not only have we secured these great new jobs for the Jefferson County region, but another headquarters has come to Kentucky. Wheeler is a Dutch-based company and an industry-leading producer of tooling systems for sheet metals. The company specializes in clamping, crowning, and tooling systems for press brakes, which are distributed to original equipment manufacturers across the globe. With this new operation, the company will enhance its customer service capabilities and strengthen relationships with existing and prospective customers. It will also reduce lead times, increase flexibility, and deliver tailored services for the specific needs of those customers. The company is a great addition to our state's thriving manufacturing sector and is creating great jobs for our families. I want to thank the company for choosing the Commonwealth and thank its leaders for our faith in being able to deliver, to fill these jobs, and to help move this company into the future. Next, we're going to talk about what is going to be the recently released 2022 overdose fatality report. So most Kentuckians, myself included, have lost not just one, but multiple people to the nation's ongoing drug crisis. I mean, so many have been lost, including children, parents, aunts and uncles, even grandparents, each one deeply loved and each one mourned by their communities. Today, we're releasing the 2022 overdose fatality report. The report found that in 2022, we lost 2,135 Kentuckians, each a child of God, because of an overdose. Of those deaths, 90% were driven by opioids and fentanyl. Potent, inexpensive methamphetamine continues to be a driving factor as well. Those are tough numbers. That means we've lost over 2,000 of our fellow Kentuckians. But there is hope, even in a number that tough. Because last year, Kentucky was one of only 8 states in the entire country that saw a significant decrease in overdose deaths, 5% less than the year before, and our first decrease since 2018. I want to thank everybody out there, from law enforcement that recently was able to intercept enough fentanyl just in the last 7 months to kill 28.9 million people, to all our treatment providers, to everyone who works in recovery. Seeing our first decrease in overdose deaths and being one of the few states, despite the fact that the nation is up in overdose deaths, means we have a whole lot of people working incredibly hard, doing selfless, amazing work. And to see this decrease at a time when the drugs are more potent than ever before and can cause overdoses, that much easier means our Kentuckians out there trying to help one another are going above and beyond. Really incredible work. Since taking office, I've made it a priority to address the epidemic head on, not to pass the buck, but to do everything we can to help our fellow human beings. Between the months, again, of October and March of last year, Kentucky's counter-drug program seized 142 pounds of fentanyl. Again, that'd kill over 28 million people. And just last month, they seized over, KSP alone seized over 13,000 doses of fentanyl. We have about $80.6 million expected to be awarded by our Office of Drug Control Policy to support addiction treatment and prevention efforts across Kentucky. Working with the treatment community, we've increased our treatment beds by about 50%. Since I became governor, I now believe, we're still looking for the comparable data, that we have more treatment beds per capita than any other state. And I'm really proud that we have our largest number of treatment beds for incarcerated individuals that we have ever had, because we've got to treat the root cause. If we want to continue to have the lowest recidivism rate in our history, we were able to announce that last year. Fewer individuals that have been released from our corrections institutions had recommitted or committed new crimes. That is, again, an amazing statistic showing that we're living out our faith and values. We're helping to rebuild families, get people in good jobs. But I think the most important thing is address the root cause that may have caused the actions in the first place. Today, we have with us Van Ingram, Executive Director of the Office of Drug Control Policy, as well as one of those hardworking individuals that's out there saving lives, Tara Mosley Hyde, Chief Executive Officer with People Advocating Recovery. If y'all would both come up and say a few words.
Thank you, Governor. I know you pay much attention to these numbers as I do, and we're excited that we have a 5% reduction, but there's so much more work to be done. I mean, we're committed to doing it as well. You heard the governor mention fentanyl. 70% of all overdose deaths in the United States, over 70% of all overdose deaths in Kentucky are caused by this scourge. And it's not bad enough that we have fentanyl, but we have fentanyl now that's disguised as everything else. It's disguised as a legitimate prescription drug, Percocet, Xanax, Adderall. All drugs that are being presented as pharmaceuticals, but really fentanyl is the active ingredient. That's really a drug poisoning as much as it is a drug overdose. Later this year, my office, along with the Division of Behavioral Health, is going to do an education awareness campaign about fentanyl and try to get the word out there to folks. You might not know what you're taking. During this past session, and this past Monday, the governor had a ceremonial bill signing for House Bill 353. That bill removes fentanyl test strips from the definition of drug paraphernalia, and we're hopeful that will help to save some lives. So folks can test that pill they think they're buying and make sure it's not a fentanyl agent. So we're excited. The numbers are going in the right direction for the first time since 2018, but we stay committed to do a lot more work to keep moving that number down. Thank you.
Thank you so much for allowing me to be here, Governor Beshear and Van Ingram. I just want to say, as a part of People Advocating Recovery, my organization, something that we do and that we really strive to continue to do is to create more opportunities, more resources across the state. So whether that looks like the expansion or the access of fentanyl test strips with House Bill 353, and access to Narcan, a life-saving drug in communities across the state. We ship Narcan out to communities, to our volunteer network, in order for folks to be able to get access immediately to that life-saving drug. So that way we can help stop these opioid overdose and poisonings across our communities. These are people's lives. These are brothers, sisters, children, moms, dads. It's everyone. It's impacting all of our communities, and the things that we can do to come together is going to help us to create a more community that's working together, that's collaborating, that's building relationships, that's creating more opportunities for folks to create employment opportunities and advancement for our folks who are in recovery, more opportunities to create upward mobility if they want to go into school and get a higher education, opportunities for folks that are looking for treatment. We need lots of opportunities for treatment, as the governor has already discussed, and lots of different types of treatment as well, which is a beautiful thing in our state. And I know for us, we look in Kentucky, I know the national numbers are very incredibly high, and COVID has really impacted a lot of our community. And I'm a person in long-term recovery, and I've been in recovery for just over 12 years. And our young people, they need support, they need collaboration, and we need communities to come together and create more opportunities for recovery supported policies in all of our workplaces, in our employment sector, in our education sector, because 1 out of 3 people have been impacted by addiction in some way, whether it's family, whether it's them, whether it's a generational experience. 1 in 3. That's incredible. So it impacts all of us, if that hasn't taught us anything yet. So the more opportunities that we can to create more collaboration and more openness and inclusiveness for recovery supported workplaces, that's what we need to do. And I think that we're in the right direction, and we need to stay the course and continue to expand. And we're on our way. So, and we just look forward to the work ahead. Thank you.
So again, in today's report, far too many Kentuckians that we're losing, but a real ray of hope that everyone doing their best every single day can make a difference. In addition to those providing treatment and recovery services and law enforcement, we owe a big thanks to first responders. One of the reasons we see the impact in these numbers is what a great job they do when they respond to an overdose using Narcan and other methods to try to give that person that one next chance of getting treatment, of getting in recovery. And the answer to how many times you should try to pull somebody out of an overdose is every single time. That's somebody's loved one. And every next day is another opportunity for them to try to get better. I think it takes a lot of bravery for someone to come forward and say they need help. But I think we're breaking down the stigma, and more people are reaching out than ever before. And we now have a bed for anybody, regardless of cost or the rest. We can find an option that works. All you've got to do is look for help, ask for help, and we can get you that help. Again, I think we're here today due to the hard work of so many, that 50% increase in treatment beds. We also need to thank our National Guard, where we've had Guard on the border basically since I became governor, after 2 separate presidents asked us for that assistance. Thinking about some other things that we've been able to launch, findrecoveryhousingnow.ky.org. This website helps people when maybe they've come out of treatment but still need some stability and some structure around them. We've now secured 181 homes that are listed on that website since it launched. And the website lists additional resources too for people who might need help in other areas. So far, the site has been visited more than 17,000 times, and a search for a home has been conducted more than 9,000 times. So this means that people are using it to get more help, and that's a really good thing. We look at the Kentucky Recovery Housing Network. So far, we have certified 54 homes across the state to help people recover. We're also fighting addiction through the federally funded Recovery Housing Program. The program helps nonprofits house recovering Kentuckians. This transitional housing helps our people get back on their feet. Since its implementation in 2020, the program has helped shelter 164 Kentuckians across the state. The Franklin County Women and Family Shelter is using these funds to ensure the safety of women as well as families with children. Today, we're joined by Janet Gates. Janet is Executive Director of the Franklin County Women and Family Shelter. She's here to talk about their program, Fresh Start Frankfort, and I think even has the t-shirt. So Janet, welcome.
That's right, the t-shirt. So we're so happy to be here. Thank you for having us today to just talk a little bit about what this important funding has done for Fresh Start Frankfort, our recovery housing program here in Franklin County. Our mission is to provide that safe, sober living for residents to call home, to begin again, a place where they can make a fresh start. And that was the reason we renamed and rebranded ourselves this year in 2023. Our recovery housing residents and the staff and our board of directors are so appreciative of the funding through the pilot program, through the CDBG recovery housing program funds that were initiated through federal funding and through HUD and our amazing Department of Local Government, who's worked with us closely in order to implement these funds in our agency. The funds have already been so very important for our Fresh Start Frankfurt recovery housing residents because we're very innovative and unique in how we're using these funds. One way is that we have implemented this program to provide subsidies for the program fees that almost all recovery housing programs have to have in order to operate. So this gives us, our residents who come to us who are low or moderate income, gives them up to 2 months where they can just settle in, they can breathe, they can just take time to set some goals, to look at the barriers that they came to us with, and maybe set some goals to address those barriers without having to worry about the program fees that are, that's what you have to do is you come out of maybe incarceration, you've been in a substance abuse program there, or maybe you're with drug court and that's a diversion program. We welcome those residents to our facility and offer this to everyone who comes to us. And it's through this important funding that we receive through that grant. So thank you for that. The other innovative and just exciting development that we're going to be able to do with these funds is create one of our units, our apartment style dwellings, into a ADA compliant residence for those single adult females who come to us and they have that need where they know they need or they want recovery housing program, but they need an ADA accessible unit to be in. And that's what we're using these funds for. Thank you so much, Governor, for having us today and your team and all the support you have given for the recovery communities across Kentucky. I appreciate you so much.
Since its implementation, Kentucky's appropriated over $3 million for the program that Janet's describing. And earlier this year, we learned that an additional $1.5 million for the overall program is on the way. I want to thank Kentucky's federal leaders for helping to secure those funds. And listen, you just saw 3 of the reasons that we are headed in the right direction. Make sure in your communities that you support those that are on the front lines that are pushing. Make sure you support your treatment centers that are around. Make sure that you support recovery housing because it's needed in all of our communities. This is the way that we address big, major problems. The answer is just together. And when you look at what we've been doing these last couple of years, we not only have this number finally headed in the right direction, we have fewer kids in foster care than we did 4 years ago. And like I said earlier, the lowest recidivism rate in our history. So listen, good people working together, not worrying about whatever arguments going on in Washington, D.C., and instead focusing on our people in need is how we create a better world. And it's how we live our faith and our values every day. So thank you to everybody who participated today. All right, next we're going to talk about electric vehicle charging stations here in Kentucky. Kentucky has taken a national leadership role in the fast-growing electric vehicle sector, and we have some exciting news to share on our next steps. And really, Team Kentucky is not just leading, we're emerging as the electric vehicle capital of America. And we're building out this massive industry supply chain right here in the Commonwealth. It started with our largest ever economic development project, the nearly $6 billion Blue Oval SK Battery Park, where we are building the largest battery plant on planet Earth. And we're building its twin right next to it. Then AESC broke ground with a $2 billion gigafactory in Bowling Green's Trans Park. And now Intervenue is building a third battery manufacturer in Shelbyville with about a $264 million initial investment. Between just those 3 direct manufacturers, we're creating over 7,450 great new jobs for Kentuckians. And that's in addition to the thousands upon thousands of construction jobs that are needed there and all these other sites that we're building. Then we had EV maker Rivian pick us to invest $10 million to establish a remanufacturing facility in Bullock County. That's going to have 218 new jobs. And just weeks ago, Toyota joined in, spending almost $600 million, taking the very first Toyota facility in the United States and still the largest in their global footprint and taking it electric. That was on top of a previous $461 million investment they had made. And what that means is that that Toyota facility is going to be secure with all those jobs for decades to come. And when it comes to EV supply chain, look at Ascend Elements, a project that's going to be well over $1 billion in Christian County, 400 jobs for that area. Liochem E-Materials, $104 million, 141 jobs in Simpson County. In fact, North America, we just announced their expansion, $53 million expansion. Since I took office, we've seen about 20 EV-related announcements with $11.2 billion in new investments for our state and 10,800 new full-time jobs. And we are going to see so much more. It's a really exciting time to be a Kentuckian where we are leading in the EV industry. So today we're taking yet another big step, this time solidifying our EV infrastructure. If we're going to build the batteries, we got to be able to charge the batteries. Today we're issuing a request for proposal from private sector organizations interested in helping us build out our statewide network of EV charging stations. This will be private sector companies that will construct up to 37 new fast charging stations along our interstates and our parkways. I think we have a map that shows you those. Most of the funding for this initiative will be from the federal formula funding made possible through the bipartisan infrastructure law. Nearly $70 million we were awarded after presenting this plan in National Electric Vehicle Infrastructure funding. Companies will be selected on a site-by-site basis to receive a portion of the funding. They will own, operate, and maintain the charging stations, but they must be open 24/7 to the public. A key to the success of the EV industry will be the availability of these charging networks along designated corridors, which in Kentucky will start with our 11 interstates and 8 parkways. Other key roads and arteries into other parts of the state will come in phase 2 as we continue to build this out. We want it to reach everywhere. Companies hoping to get in on this opportunity to help us continue to be the EV capital of the United States of America can learn more at evcharging.ky.gov. And we have news today on another exciting RFP. Now, over the last several years, when it comes to infrastructure, we've truly been doing what other people called impossible. The major projects, the mega projects that have been out there have always been the I-69 corridor, the Brent Spence Companion Bridge, and the Mountain Parkway. And we are making progress, more progress than we've seen in decades on all 3 at the same time. On I-69, we're so far ahead of Indiana. They are working to catch up. We now have work done on every part of that, or work being done right now up to where the bridge itself will be. Brent Spence Companion Bridge is going to happen. It's going to happen without tolls after securing the largest infrastructure grant in U.S. history. And today, we are announcing that the final leg of the Mountain Parkway expansion, 4-laning the whole thing to Prestonsburg, the RFP has gone out for that final portion. This is the portion known as the Magoffin to Floyd segment. This will look for a design build team that will develop and design the last 13 miles that extend the parkway from Salyersville to Prestonsburg. Last September, I announced our preferred route, which is called the cross-country route, which impacts fewer properties and also will have few to no stoplights, meaning like when you're driving on an interstate or a parkway, you're really going to be able to move on this thing, cutting down that time. By doing it, we also are able to keep open the existing route, meaning people are going to be able to travel the current Mountain Parkway without the extra construction that would be in between Salyersville and Prestonsburg. Listen, this is enormous for this region. It's making good on a promise that started decades ago, and it's creating an artery that goes into Eastern Kentucky like I-64 does for part of Eastern Kentucky that is going to bring jobs. One of the major reasons that we sometimes struggle to locate a factory, let's say, in Eastern Kentucky is they say the lack of a 4-lane road. We are going to have it. And we've already seen the first company select Magoffin County because of the work being done on the Mountain Parkway. This is a game changer. It's going to provide improvement to our quality of life, to so many of our families. And our goal, because we believe in it, is to stop the depopulation of Eastern Kentucky and to make sure that no matter where you live in Kentucky, your kids can chase their dreams no matter how big they are, and they can chase them in the region they're from if they so choose. So big news for Eastern Kentucky today. With a little help about 5 months from now, I plan to be the governor that sees the four laning of the entire Mountain Parkway. Okay, next up, we have an update on the Department of Juvenile Justice. For months, my administration has been implementing sweeping changes to better address the challenges in juvenile detention facilities and better protect our staff and our youth. Since December, we have separated male juveniles by classification seriousness of the crime, so that we don't have one juvenile that is being that is going to go on trial for murder next to one that is in for a status offense. We've opened the first female-only detention center. We created a robust transportation branch to assist local law enforcement for the first time. We made defensive equipment available to our detention center correctional officers who'd gone years without some basic things to protect themselves. We reclassified security personnel within the detention centers from youth workers to correctional officers and raised their starting salary to $50,000. Well, I believe when I became governor, it was under $30,000. We appointed 2 former adult prison wardens as the executive director and deputy executive director of the Office of Detention. That's James Sweat and Larry Chandler, who bring 40 years of experience on how we need to address especially the physical security of these facilities. We made substantial improvements to the facilities themselves based on these recommendations, and we worked with the General Assembly to pass budgetary needs and legislative action. In March, I signed Senate Bill 162, appropriating more than $25 million to the Department of Juvenile Justice for staff salaries, facility upgrades, and transportation costs. That'll go into effect July 1. These changes have made significant positive impacts. We are seeing significant increases in staffing, but we still face challenges. While they have improved security staffing in our detention centers, the female-only Campbell Regional Juvenile Detention Center is experiencing critical staffing issues. We've been filling it with probation and parole officers from the Department of Corrections who have been volunteering on their days off to help keep the Campbell Youth Detention Center safe and secure. They provided crucial assistance, and we cannot thank them enough, unfortunately. Our staffing numbers there are nowhere near where they need to be, especially with a number of the individuals having significant needs right now in that facility. While we see an end in sight and we see a future where we can meet the staffing needs of the Campbell County facility, right now the situation has gotten too critical. So that is why we are going to temporarily relocate the juveniles currently in the Campbell County facility to the Boyd County Juvenile Detention Center. Again, a temporary step. Campbell County is the only female youth detention center, and in order to keep our females separate from our males, which we believe we have to do, especially right now, the males that are currently in Boyd will be temporarily transferred to the Breathitt Regional Juvenile Detention Center. We have enough space. We have enough staffing in those facilities. This is a step that no one wants to have to take to move juveniles to different facilities, but this is our best opportunity to provide the most safety for them and for the staff. And no one would want to see a bad outcome in Campbell County because of our current staffing issues. Listen, most of the things we've done in DJJ are because we have to, and we are seeing the situation improve, but this is still a step until we are at a better staffing level that we have to take for the safety and security of first the juveniles, but then our staff themselves. Remember, these are all pre-adjudicated youth, meaning the time that they are in this really depends on how long it takes in the legal system to get a conviction, an acquittal, a sentence, a referral outside of it. And we continue to encourage the judicial system to work as quickly as it can. because we don't want youth in a pre-detention facility any longer than they need to be. To assist with transportation, we're going to work closely with law enforcement during this temporary change. Again, the most important thing is the safety of both the juveniles and the staff. This is a decision we had to make because we prioritize that. All right, a quick update on Eastern and Western Kentucky rebuilding. Currently have 93 households in Eastern Kentucky in 96 travel trailers. That means 5 families have transitioned since our last update. 289 families have now transitioned out, finding more secure housing. I think that's somewhere around 2 times more than we ever had in the West in travel trailers. This says that people are finding places that provide more security in the long term. And as you'll see in a minute, it shows that the rebuilding effort is underway. Even if we haven't seen the big surge that we are going to see, I believe, late fall and after. FEMA has now approved more than $107.1 million in individual assistance grants. The buyout program now received over $34.4 million in FEMA awards. These are individuals who live in the floodplain that FEMA buys their home and their property from them, gives them the dollars they need to move to a safer location. We're now over 200 properties that have been bought. It's 202, and they're from Perry County, the city of Jackson, Breathitt County, Letcher County, Knott County, and Floyd County. FAHI, an amazing housing organization that's out there, has been trying to get as best they can an accurate count of the number of homes that nonprofits are working on, some with our assistance, some out there using their own funds. To date, the last report, they had 147 new homes constructed, 259 rehabs. That means 406 families. Most flood survivors, but this is also affordable and accessible housing that may be helping people that were struggling before the flood. But that is good news. That's only going to increase as we go. The lion's share, if not all of the credit ought to go to these nonprofit organizations. So many of them out there in the East and in the West doing really incredible work. And it's great to see. I mean, in the West, we've got some organizations that started right after the tornadoes that are finishing their mission. And then we have other groups that are coming in right now and building dozens upon dozens of houses. I mean, God is good even when it's tough. And it is amazing to see people come in and fill the need a year and a half, 2 years out to continue to rebuild these communities. Today, we have one new award to announce from the Western Kentucky Safe Fund. Mayfield Independent School will receive over $373,000 to recover lost revenue as a result of the tornado events. In Eastern Kentucky, the board's approved 5 awards totaling $6.9 million. Beattyville is going to receive $375,000 to assist with the strain of fiscal demands and engage a professional planner who's going to assist the city's long-term recovery efforts. Breathitt County is approved for $3 million to assist with the strain of fiscal demands. The Breathitt County Water District is going to receive $235,000 for strain liquidity and $34,768 for a FEMA match. City of Hindman was also approved for $250,000. And the Knott County Board of Education is approved for just over $3 million to assist with the strain of fiscal demands. Rebuilding, especially in the East, is probably one of the toughest challenges that the nation has ever seen, but we are going to get it done. It's going to take us years. But when we come out of this, our goal is to have more housing, more opportunity, more access for our families, to reimagine communities, to connect people with services that maybe it was difficult to get to before. This is a long-term commitment to these communities. We are not going anywhere, no matter how long it takes. And finally, today's Team Kentucky All-Stars are the winners of the Governor's Ambassador Awards, some of our most special state employees. Over 176 nominations were received for these awards, and the winners that were selected, they supported tornado survivors. They helped disabled Kentuckians get more independence. They served as healthcare heroes, and they supported our heroic veterans. These awards recognize acts of service from last year, and it was special to have them in the rotunda to celebrate their importance as part of Team Kentucky. The winners include, for the Courage Award, Jessica Eisen and Tracy James of the Kentucky Department of Parks. They helped a small child, the sole survivor of an accident that took that child's family, and the immediate aftermath of that accident, showing a level of compassion and love and grace that I hope sticks with that child. The Teamwork Award is the Restorative Department at the Eastern Kentucky Veterans Center, Kentucky Department of Veterans Affairs. The Leadership Award went to Michelle Grant Rudovich for her work for the Kentucky Board of Nursing, especially during the pandemic. Michelle passed away last year. She worked with me for 4 years at the Attorney General's office and then at the Board of Nursing and otherwise in the executive branch until the time of her passing. We're about the same age. We miss Michelle. Her family was there to accept the award for her. I know how proud they are of her. The Community Service and Volunteerism Award went to Jillian Hall and Andrea Fredrisi of the Kentucky Public Pension Authority. The Customer Service Award went to Clinton Matney, Office of Vocational Rehabilitation, Education, and Labor Cabinet. And the Professional Achievement Award went to John Trowbridge, Kentucky National Guard, Department of Military Affairs. Kentucky is full of incredible people. We saw some of them in our battle against this opioid crisis here today. These are some others getting out there and helping their fellow human being, living out their faith and values every single day. And if we think about just these stories, there's another example. That's Bobby Smith. He's a highway technician supervisor in Knott County. He was recently recognized by the Kentucky State Police for his heroic efforts to rescue a young driver who was trapped under an overturned dump truck. It was at the end of May. Just another example of people doing heroic things when they are needed the most. All right, with that, we will turn it over to questions. We've got 3 in studio and 2 on the line. We'll start with the Dean, Tom Latek.
Thank you, Governor. Good afternoon. I have a question for Mr. Ingram, if at all possible.
Sure.
Make it easy on you.
Yes, sir.
You spoke about fentanyl showing up in other drugs, prescription drugs, what have you. How are people getting these? I mean, if I go to Walgreens, I'm not going to get a fentanyl laced whatever.
No, it would be involved in the illicit drug market. Same way all drugs are moved across the country and sold by those individuals that traffic in drugs. It's also, sometimes it's presented as cocaine or methamphetamine, but it's really methamphetamine with fentanyl involved. Methamphetamine was involved in 50% of those deaths. And you heard the governor say opioids in 90%. So there's a lot of overlap there.
And all I'd add with to Vans is that oftentimes people will use even illicitly bought prescription drugs to try to balance out, right? To when they're up or down, to try to in many ways, I guess, cope with their addiction, but to try to get their body where it needs to be for their daily functioning. And so those are purchased illicitly too. And it was when I was Attorney General that we first discovered fentanyl had then been pressed into pills and pill form, which people hadn't expected at the time. That's why there's a national discussion on pill presses and what ought to be done there and how available they ought to be. When you think back when we had the mom and pop meth labs that were so dangerous around Kentucky, one of the ways that we really addressed that was to put stricter controls on the ingredients that people were using to make it. So that's part of that discussion there nationally. We have Aaron Kelly here with us from Spectrum.
So one of the key findings of the report is that there was a decrease of overdose deaths in Jefferson County from 572 in 2021 to 505. What do you see as working in Jefferson County that maybe should be replicated elsewhere in the state?
Well, in Jefferson County, like in the rest of the state, we have amazing, hardworking people from so many different professions that have come together to make this possible. It starts with law enforcement doing everything they can to stop the illicit drug trade, to EMS. My goodness, firefighters and first responders and EMS out there making more rescues than ever before. It's the availability of Narcan, which people have pushed out significantly, and families if they're worried about a family member, definitely ought to have Narcan. Every business ought to have Narcan. And then it's the treatment and the recovery community that are just doing amazing work, less stigma than ever before, better treatment, both in jails and prisons, but also in the private sector. This is everybody, thousands of Kentuckians, all rowing the boat in the same direction, all giving selflessly of themselves. And let me just last give a big thank you to peer support specialists and counselors. My goodness, these are individuals that have, I mean, Tara talked a little bit about her story. These are people who have gone through addiction, probably the worst moments of their life, the worst trauma of their life. And they are willing to talk about it and show it and walk back into it to help out other individuals that are out there. It's one of the most amazing expressions of living your faith that I've ever seen. And they're getting better and better and better at it. People sharing knowledge. We have multiple modes of treatment now because what works for one individual might not work for another. You got groups working together where if it's not working in one area, they'll be referring people to another. So the answer is thousands of amazing Kentuckians working their hardest every day. All right, McKenna.
Thank you. And this is related to House Bill 3 discussion and juvenile justice. But in light of data recently received by the Juvenile Justice Oversight Council, should the legislature revisit the mandatory detention requirement before it takes effect in July 2024? And what would be the price tag of detaining additional juveniles for adjudication? I think according to numbers, there would have been about 450 more.
Let us get you. I don't have that cost, but we can get it. I will say this: if we had 450 more juveniles we had to detain in pre-adjudication right now, we couldn't do it. We don't have the capacity. We don't have the staffing. It would not be safe to have 450 additional juveniles at this time. At some point, the policy has to meet the reality of your ability to serve these juveniles in a safe and responsible way. So listen, this is an ongoing challenge. We haven't seen the last work from the legislature. We're going to continue to brief and work with them. And it's going to be important for us to very clearly express the capacity that we have, that we may have in the future. We report regularly on our staffing levels, but right now we could not house an additional 450 juveniles. It just wouldn't be possible. All right, Karen Czar.
Good afternoon, and thank you, Governor. You just mentioned the importance of businesses and everyone really carrying Narcan. And I actually did an interview last week with the Fayette County Health Department. They're trying to spread that message as well. And they said some businesses have this perception that, oh, I wouldn't need it here, or some people are afraid to carry it because they think it might be too difficult to use. You had your own firsthand experience, I think it was 2017, on how quickly naloxone can turn things around. Are you willing to share that to kind of encourage people to have it with them?
Yeah. Well, it was in Lexington too. So in 2017, we were in Lexington, and it'd be the middle of the day, 2:30-ish in the afternoon. And we were right in front of the Opera House, you know, with a stoplight that's there. And traffic had backed up. We saw this kind of big plume of smoke and got out. And the person in the very first car at the stoplight had overdosed. As a large man and had to, along with Josh Keats, who's now over at Homeland Security, we had to pull him from the car so that we could try to administer first aid and Narcan and naloxone that a Lexington police officer had with him. I still remember pulling this man, trying to get him out of this car, and he stopped breathing. I watched the colors drain from his face. I'd never seen somebody die in front of me like what was happening on the street right there. But watching eventually Lexington Emergency Management, EMS, arrive and administer it, and somebody who I would have sworn was dead and gone was back was back and had another opportunity to make the changes that he needed, another opportunity to get treatment. And while I don't know him, I know he was somebody's child. He might be somebody's dad. He was somebody's friend or loved one. And listen, we've got to do everything we can anytime someone is overdosing, whether it's the first or the 50th time, that is still a child of God. And it is our duty to do everything we can to keep them here on this earth and to give them one more chance. Narcan is really easy to use. There are virtually statistically 0 cases where you can cause harm to someone in the long term, especially with the nasal spray now, very easy to administer for anyone and everyone. It's easy to store, though. Make sure that when it expires, you get a new thing of Narcan. This is really easy to put in one specific place, maybe where you have the first aid kit. In an office, it'd hardly be noticed by folks that are in there with the box that it's in. You want to have the tools you need if the worst happens in your workplace, as opposed to not having them. All right, and finally, Joe Sonka from the Courier-Journal.
Thank you. This week, former President Trump was indicted for mishandling classified documents and obstruction of justice. There have been some elected officials in Kentucky who have defended Trump and suggested he was being unfairly targeted. I don't believe that you've commented on his indictment yet, so I'm asking you if you've seen the indictment and read about it and have a comment on it.
Well, I trust the legal process, and we have to let it play out. Let's remember, this isn't one prosecutor. This is a grand jury of Americans that we trust to make some of those initial decisions. But let's also remember that everyone in the criminal justice process is innocent until proven guilty. We created this system so that we could ultimately get to the truth. And I trust the criminal justice system to eventually educate all of us on what happened, what is true, and to take any steps that should or should not be taken. All right, that's this week's Team Kentucky Update. We got it in 45 minutes. Thank y'all. Happy birthday, Will.